Hey guys, I'm Dr. Jaishree Sharad and today we shall discuss all about acne. Acne is such a universal problem, isn't it? What is acne? Acne is a medical term for blackheads, whiteheads, pustules and pimples. It is a chronic inflammatory disorder of the oil glands present in the skin. Now these oil glands, called sebaceous glands, open into the hair follicle. These glands secrete an oily substance called sebum, which empties onto the skin surface through the hair follicles. Now during puberty or when there is a hormonal imbalance, the male sex hormones, which are normally present both in males and females, are on the rise, and they activate the sebaceous glands to increase in size, which in turn leads to an increase in the secretion of sebum. Secondly, the cells are shed more rapidly and they stick together, plugging the opening of the hair follicle, resulting in whiteheads. When these whiteheads get exposed to air, they form blackheads. So blackheads are not dirt. Thirdly, there are bacteria called Cutibacterium acne, which increase in number and they add to the formation of acne. Now finally, when the follicle gets clogged, the wall ruptures. There is an inflammatory reaction. The bacteria, sebum, dead cells escape into the surrounding tissue and lead to the formation of more severe form of acne in the form of pustules, nodules, abscesses and cysts. Now, are there types of acne? Yes. Mild to moderate acne are seen as blackheads, which are comedones, and whiteheads. Then there are pustules, and in severe cases you see nodules, cysts and abscesses, which may lead to scarring if not treated on time. Now there can be truncal acne too, so acne on the chest, back, shoulders and sometimes even on the butt. So wherever you have oil glands, you can have acne. Is it a misconception that acne only occurs during teenage years? Absolutely. Now acne can occur even in your 30s and 40s. It is a condition known as adult acne and it usually occurs due to a hormonal imbalance in the body. Now acne is usually more common in males when they are teenagers. Why? Because men have more oil glands. However, in females, acne is more common in adults due to a condition called polycystic ovarian syndrome. And now it's really so common in the urban female population due to lifestyle. So what are the causes of acne? It could be genetic, it could be a hormonal imbalance in the body, such as PCOS, which is polycystic ovarian syndrome, or there could be insulin resistance or raised DHT hormones. Then it could be due to oil-based cosmetics, which are clogging the pores. There could be hair oils and brilliantines, which are clogging the pores. People who work in chemical or oil industries and come in contact with hydrocarbons, heavy oils, cutting oil, wax, grease and coal tar derivatives can also develop acne. Sometimes drugs such as oral contraceptives, anabolic steroids, growth hormones, isoniazid, which is given for tuberculosis, lithium, phenytoin, etc. can cause pimples. And finally, poor lifestyle comprising of unhealthy diet, a lot of sugar, dairy, white flour, late nights, alcohol and smoking, as well as stress, will aggravate acne. Gases from vehicles, such as industrial gases, carbon monoxide, sulfur dioxide, nitrous oxide, volatile organic chemicals and fine particulate matter in the air can also clog pores, resulting in acne. Now, what are the major do's and don'ts when it comes to acne? Let's look at the do's. So first, wash your face with a salicylic acid based face wash twice a day. Salicylic acid is a good exfoliant and it helps to remove the excess skin cells on the surface of the pore so they don't build up in the pore. Use a water-based moisturizer. Use an oil-free, gel-based or water-based sunscreen with an SPF of at least 30. Increase the intake of citrus fruits such as oranges, grapes, lime, lemon, all the berries, and all the food stuff which is rich in vitamin C and zinc. Drink at least 3.2 liters of water per day. Now, what are the don'ts? Do not pick or squeeze the pimples. This will cause infection, hyperpigmentation, as well as scarring. Avoid the use of oily cosmetics, cleansing milks and lotions. Do not apply excessive hair oil or other hair products if you have acne over the forehead or hairline. Avoid sugar, dairy, and food with high glycemic index, because these will cause an increase in a hormone called IGF-1, which will result in more acne. Do not try stuff like toothpaste, lime, lemon, etc. You may apply neem and turmeric paste for a day or two. If it doesn't help, do not try anything else. Just go and consult a dermatologist. Finally, it's extremely important to avoid stress. Learn to cope with it. You could try meditation, pranayama, yoga, develop some sort of a nice hobby where you have your me time. When should you opt for medical help? Now, when acne persists, in spite of using all the over-the-counter acne creams, or if you develop cystic acne, nodular acne, acne which leaves scars behind, you must seek medical help. Now, for comedones, we normally give topicals such as tretinoin. For mild inflammatory acne, we give topical retinoids or a topical antibiotic or even a benzoyl peroxide to apply. When there's moderate acne, we also give oral antibiotics and a topical cream. Now, sometimes if you have cystic acne and then you have a very important event the next day, we do give you an intralesional triamcinolone injection. And within 24 hours, the cyst disappears. Now, what about treatments? Comedone extractions or cleanups done at a hygienic skin clinic will prevent scarring. Do not try it on your own. Carbon dioxide cryotherapy, plasma therapy, salicylic acid peels, mandelic acid peels, lactic acid peels, as well as blue light will also help to reduce acne. It's important to treat acne to reduce the extent of the disease so that there is no scarring and that psychological distress is gone. For more, do not forget to post your comments here, like, share, and subscribe to Forever Youthful with me, your host, Dr. Jaishree Sharad.